Alright, so how do vaccines affect the well-being of children in the United States? So some direct effects of not vaccinating your children would be, one clear one would be that your kid could pick up a disease and then they'll have to spend like 2 or 3 weeks in a hospital, whereas like you could just go to the pediatrician and then an hour later you're vaccinated and you don't have to worry about it. Another issue is that it harms the immunocompromised population, so people with like AIDS or cancer, they're more susceptible to these diseases. So like if they catch it, like they're more likely to die or fall much more ill. And then another point is that herd immunity isn't as effective. So the CDC recommends that for whooping cough and measles, at least 92% of the population should be vaccinated so that it can stop these from spreading and becoming an endemic. And it also, herd immunity also protects the immunocompromised population, so they don't have to worry as much about catching that disease. Professor Louis Magner describes that vaccines have not been linked to a single death. So why are more and more parents exempting their children from getting their vaccinations? One point is that these parents will find like false information from like Facebook groups, and then they will conclude that like vaccines, like they'll hear these false stories from these parents, and then they'll decide that like vaccination is bad, and that like no matter how much evidence you provide these parents, they just won't change their mind on vaccination.
Parents who don't immunize their child think that vaccines cause things like autism or other diseases, but there has not been a single report or case study that has proven vaccines that have led to autism. And parents who are against vaccines aren't just putting their own kids in danger from getting certain diseases, they're putting other parents' child in danger by letting their unvaccinated child go to school or parks or other fun things like Disneyland, because there was a measles outbreak in 2015 at Disneyland. And then Joey talked about some parents relying on herd immunity, which really is just, for herd immunity to be effective, herd immunity for a highly contagious disease like measles requires vaccination rates of 95 to 99% of people, which isn't, parents who don't vaccinate their child rely on this so much, but if we are vaccinating children up to 95 to 99%, herd immunity isn't going to work. This is a picture that shows different diseases and how many people died before vaccinations, which are all the way in the thousands, and then how many people have died, the most recent reports of people who got them, and then these are the percentages of how much, the percent decrease of how much people have died from those diseases.
Okay, so is it ethical to vaccinate our children? During the mid-20th century, about 48,000 cases of rubella were diagnosed, but today there are less than 24, so that'd be over here. It's German measles so 70,000, 60,000, 50,000. This is 1969, and here is 1971. You can see there's a dramatic drop because that is when the one of the first big vaccinations was administered to the population. Other diseases like this, including polio and diphtheria, have been nearly eradicated through the use of vaccines. Conducted studies have shown that vaccinations have helped dramatically decrease several illnesses, other illnesses like chickenpox and measles and whooping cough. This is shown through how many people go to the doctor to get the vaccinations, and if they come back later to get treatment for the sickness. The United States was one of the first countries to make vaccinations required by law. So it was in the 20s, probably the earliest on here would be the thousands, which is right here, so that would be the 1800s. But the US, which would be the 20s, is one of the first, like all these other places, to get vaccinations. However, places like Nigeria only got vaccinations in the 70s, and they did not have vaccination laws until the 70s. So smallpox ceased to be an endemic in the country in the 70s, which shows that once the vaccination was administered, the smallpox was started to go down. And then other places like this, they just do not have any data. But this shows that when the vaccination was administered early, smallpox it went downhill and there weren't as many cases.
Alright, so one of our first solutions would be to just provide more information to new parents on like why vaccination is good and how it helps benefit the entire population. So like while the parents are like still in the hospital after their child is born, give them information then before like they're exposed to these groups that can give them like false stories and change their minds. But an issue with this is like if they do research like beforehand, I guess the doctors could talk to them, but these parents are still going to like find this false information. So just giving better information to these parents on why it's good would be a good solution.
Solution number 2 would be to just vaccinate your children. Many medical professionals from like the CDC, the WHO, which is the World Health Organization, all recommend that you vaccinate your child with the necessary vaccinations around 7 months old. This can help prevent several illnesses, as said before. It does affect their health, and it does help them maintain a healthy lifestyle. And that works.
Okay, I have a couple questions for you. I'm going to start with Hannah. Give one specific way that your thinking changed as a result of learning about Eli's findings.
I think my thought process changed because Eli had maps showing of different areas that when they first started vaccinating, and it just showed how many areas didn't get vaccinated until later days, like the 1970s or 1960s, which just is a reason for many more people to get vaccinated.
Okay. Joey, next is for you. In what way did you improve your ability to work with a group as a result of this project?
I feel like I improved in communication with my team. Because before, I hadn't really done many group projects, so I really hadn't built communication skills working with a group. So I feel this forced us to work collaborate a lot more. So communicating with our group was a big point of our presentation.
Okay, thank you. And finally, Eli, describe how the content of the team's presentation was changed as a result of group discussions.
Well, there were a few things. So, there in our outline document that we had, there were a few pieces of evidence that we all bounced off each other, and we were like, hey, this kind of goes not against what I'm saying, but it brushes against it in a way where maybe we shouldn't put them right next to each other. Maybe just put this evidence here and this evidence here, and then this one there, just to sort it all out.
Okay, thank you.